Welcome to Public Health Ideas. My name is Sandro Galea. I serve as Dean of the School of Public Health. Today I'm speaking with Derek Brown and Lindsay Stark. Professor Brown is Associate Professor and Lindsay Stark is Professor at the Washington University Brown School of Social Work. Today we're going to be talking about the recent paper in the Journal of Interpersonal Violence, The Economic Burden of Intimate Partner Violence in Colombia, Estimated Health Costs Among Females Aged 13 to 24. Lindsay, let's start a bit with you. Tell us a little bit about why this work came about.
So we have been partnering with UNICEF for a number of years now to think about how to make the case for policymakers around gender-based violence, which we know is a really highly prevalent problem all across the globe, and what kind of data policymakers actually need to be able to make proper investments and to move the needle on this problem.
Tell us a little bit about the problem, intimate partner violence in Colombia. What do we know about it? Where are our data strongest? What don't we know?
So intimate partner violence, which is violence that includes physical violence, sexual violence, emotional violence that's perpetrated in the home primarily by a husband, a spouse, a boyfriend, a girlfriend, is one of the most highly prevalent forms of gender-based violence. And estimates are that approximately 24% of women will experience intimate partner violence across the lifespan. And this problem is especially, the prevalence rates are especially high in Colombia, where there's been a long history of conflict and other factors that have driven the rates of violence up.
Let's talk a little bit now about costs. So what's the relationship between conflict, burden, costs of intimate partner violence?
Well, first of all, I would just like to note that within conflict, intimate partner violence has been largely hidden and largely considered an invisible burden. And so for years and years, the focus around gender-based violence in humanitarian emergencies has really focused on perpetration by armed forces, armed actors, other people outside of the home, in the community, perpetrating violence. And it's only in the last decade or so that we have really seen humanitarian attention acknowledge that actually the violence that's happening in the community more largely is also infiltrating the household and driving up rates of intimate partner violence. I don't know, Derek, if you want to say anything about the economic burden as well.
Sure. So we believe that the economic burden, in addition to needing to be quantified, might be differential or disproportionate by conflict. So we thought that there were kind of two potential mechanisms. The incidence or prevalence of IPV is about twice as high in the conflict-affected population. So we found that in our data source. And then secondly, we tested to see if there were kind of increased or worse risk of health impacts among that conflict-affected population.
Lead us a bit through the data. Tell us a little bit about actually how you went from data to quantify the cost of this challenge.
Sure. So I think with a study like this, data is definitely kind of one of the key challenges. So we wove together kind of a series of sort of epidemiological and economic principles and a couple different data sources. So at the core of it was this violence against children survey known as the VAX. And this is an effort that's been done in multiple countries. Lindsay's been involved with the kind of development of this and some of the formative work in Colombia. But the Colombian government, UNICEF, the CDC in the United States, all of those entities and a few other partners have facilitated these violence surveys. So we had the Colombia data there to give us information on prevalence and incidence both of partner violence. And then we had some other questions on that same instrument to look at specific negative health outcomes or consequences. So putting those two pieces together, we were able to measure the increased risk associated of health problems with IPV. And then the data also facilitated that conflict and non-conflict analysis. We next need to combine that with kind of the severity of the health problem in disability-adjusted life years So for that, we turned to the Global Burden of Disease series, which is available for lots of different countries over many long time series. And so we used that piece kind of with the VAX to estimate the shares of specific health problems and how much was attributable to IPV. And then finally, we need to quantify kind of the economic burden in terms of dollars or currency. And there's not a single necessarily kind of accepted value or number for that from economics, but at least as a lower bound, it's a standard practice to assume that a gross domestic product per person or per capita equivalent for one disability adjusted life year. So basically those three pieces put together.
Tell us a little bit about what you found.
Yeah, so we found a pretty large number, and we also found that the conflict burden was disproportionately high. It does seem to be driven more by the higher incidence of IPV in that conflict population. We didn't actually find an increased risk of those outcomes, but simply that they're more common, and that drives a large share of costs. So yeah, it particularly shows kind of the severity of the issue.
So at the end of the day, you had about $90 million a year health burden linked to physical intimate partner violence. Ground us a little bit, like how do we understand that number? What do we do with it? And how does that quantification help move forward the conversation on this?
Sure. So I think these kinds of numbers can be abstract and a lot of times seem really large, but I think they're useful in multiple different ways. So the first is, I think, to draw attention kind of to the severity or the magnitude of a problem. It's also naturally a common language for policymakers who wrestle with budgets all the time. And so they know that their resources and that their priorities also kind of come down to dollars. And we can do this using common frameworks for other problems in public health and social work. So that's one thing. I think another is we could combine this with other potential evaluations or strategies to basically do like a cost effectiveness or a cost benefit to do some resource prioritization around further prevention. But you need something like our study to kind of provide that framework first with those other evaluations.
Yeah, I thought it was a really elegant analysis. Actually, what drew me to the paper. Let's shift now to what can be done with it. So what investment, either local or multilateral investment, can actually move the needle on intimate partner violence?
Yeah, that's a good question. I think at one level, I think now when you've got this established, the problem is a little bit less ignorable in terms of kind of the financial costs. We know that it's not just it's not only a human rights and social justice issue, but this is something that actually is going to feed back through the whole economy. So policymakers really need to consider that and consider that opportunity cost if they don't address that. And then kind of building on that, I think, this makes the case for stronger institutions. And so whether that's legal and kind of cultural establishments that we are going to actually enforce and encourage our police and judicial system to take this problem seriously, because there's economic consequences as well as the ethical importance.
And if I could add to that, we did have the opportunity to present the results of this data back to the government. And I think it's extremely powerful to be able to say, our estimate found that in a single year, if you work to prevent intimate partner violence, you would be able to recoup upwards of $90 million. I mean, it's just an extremely, as Derek said, hard thing to ignore. The other thing that we were able to say is that this was actually a conservative estimate. So we're only looking at 13 to 24-year-olds across a single year. So you think about women and girls on either side of that age bracket that we're not including. We're not including femicide, lives that were lost. And in terms of the health outcomes that we were able to quantify, we were, as Derek said, restricted by what was available in the data. There are many more health outcomes that we would have liked to have quantified and costed, as well as labor costs that are lost due to intimate partner violence. So really this huge figure is just the tip of the iceberg.
Yeah, and I think that leads nicely to the last question. I mean, this is such an important issue all over the world. Where do you see the research headed? What are the big research gaps? If one were building a career and thinking about this, where can one make a difference?
There's many places where people who are interested either in programming, in response, in government policy, or in research to get involved and to think about ways to solve this problem. We have been working very closely with the Los Andes School of Government in Colombia to begin to think about policies and practices to prevent and curb intimate partner violence. And so we have partnerships right now with a number of civil society actors testing interventions around changing gender norms and social norms, around economic strengthening of vulnerable women, around housing programs for vulnerable women. So we're looking at a number of different interventions and how they potentially might support primary, secondary, and tertiary prevention of this issue.
I thought it was a really excellent paper. Thank you for the work you're doing, and thank you for joining the conversation.